Okay, everyone out there, this is Rob Sawyer, the Chief Scientific Officer for Olympus Health and Performance. I want to do a little update because we now offer three different kinds of tests for the COVID-19 or SARS-CoV-2 virus. The most standard test right now, which we do offer, is the PCR test, and that looks for genetic material from the virus. The advantage is it's the most sensitive way to see if you actually have the virus and is really very good if you have symptoms of the virus. The problem is it takes about 24 to 48 to sometimes even 72 hours to get the results of that test back. The second test that we can use to see if there's virus living in your body is the antigen test, and that finds or looks for antigens that are on proteins that are on the virus itself. That's a rapid test. We can give you results of that in about 15 minutes. And the only difficulty with that is it's not quite as sensitive as the PCR test. Therefore, we like to use it mostly in people who don't have symptoms, where we think the suspicion's a little bit less that the virus is actually there. The third test that we still offer is the antibody test. And the antibody test is really useful to figure out whether you were infected with the virus more than at least 2 to 3 weeks ago. Say, a month or two ago you had some symptoms and you never got tested for COVID-19, you'd like to know. It also will give you some idea, we think, about whether or not you have some immunity to the virus, though we're still working all that out. So anyway, we have those three tests: the PCR test, which we think is really good for patients with symptoms; the antigen test, which is really good for people who don't have symptoms but are still concerned, maybe they were exposed to somebody that they could have the virus; and then the antibody test, which is really useful to try to figure out whether you may have had an infection further back in time. If you go to our website, it's all explained, but of course we're always ready at any time to answer questions on the telephone or on our website. So anyway, have a good day, stay safe, wear a mask, wash your hands, all those other things, and if you feel that you need to be tested, go to our website and we can set you up. Thank you.